Hello, I'm Dr. Panigrahi and I go by Dr. Pani, easy to pronounce, and I'm the medical director for the Ornish Lifestyle Program, and I'll be available to answer some of your questions while you are participating in the program, and if needed, we can also sit down together for an extended period of time in order to help you understand at a deeper level. I'm glad to have you all in this program. Today we are going to talk about heart disease and how it happens, and secondly, how we may be able to reverse heart disease by the Ornish Lifestyle Program. Heart disease has been the common denominator of death in the United States for the past 100 years. That's on account of our lifestyle, which includes the high fat, high cholesterol containing diet, and mostly a sedentary lifestyle. So I'm going to explain this utilizing this model here, which you can see. This is a model of the heart. So the heart is comprised of the muscle, and even though the blood inside is pumped into the aorta to be supplied to all the body tissues, the heart muscle itself gets its blood supply by virtue of the arteries those are running on the surface of the heart. There are three major arteries. One is on the right side called the right coronary artery, and the second large one is the front of the heart called the left anterior descending, and the third artery that goes behind the heart is called the circumflex coronary artery. They carry the blood coming from the aorta and supply to the heart muscle to deliver the nutrients, the oxygen, so the muscle utilizes those elements in order to contract. Now let us look at the inside of these arteries. So once you remove part of the roof of this artery, it is a very much a tubular structures, and inside the lumen, the blood vessels are, all the constituents of the blood are getting downstream to be supplied to the muscle. These disc-shaped tissues are the red blood cells that carry the oxygen, and they are floating in the fluid that we call plasma, which carries all the nutrients, the glucose, the protein, the fat, the vitamins and minerals, to be delivered downstream to the muscle so that it will be utilized. As you can see, the wall of this artery have three layers. The internal lining is the endothelial lining that separates the constituents of the blood from this wall. The middle layer is composed of muscle so that the artery can constrict and relax, and the outer lining is a collagen tissue, very strong, in order to maintain the patency of this artery. Nature has provided the internal lining with the maximum potential so that, in fact, the blood and the constituents of the blood even do not touch this layer. And this is a very protective mechanism. How so? The endothelial cells produce chemicals. Those will be negatively charged, and they repel the constituents of the blood. However, if the blood contains excess of cholesterol, excess of fat, excess of glucose, or the blood pressure is high, or someone is smoking the tobacco products, these are the elements that damage the lining, and when that happens, the lining no more able to produce the chemicals which is protecting the wall of the artery. Let's take, for example, the high cholesterol, which deal with the everyday from our diet. Once the cholesterol level is high, this is damaging the lining and the cholesterol is getting into the wall of the artery. And this is the beginning of atherosclerosis. And believe it or not, in our diet that is very prevalent in our country, these lining or these cholesterol buildup have started by the time you are about 20 years of age. And if you continue the same dietary pattern, by the time you are 40, 50 or 60, it has progressed to the extent that there is significant narrowing of the artery has occurred. In this case, let us say 80% of the lumen is constricted, and as a result, there is hardly any blood going downstream. And that is the time you begin to experience the symptoms of chest pain, shortness of breath with activity, and this brings you to the contact with your physician. Then we do certain tests, and in order to treat this condition, we do the bypass surgery or balloon angioplasty or the stent procedure and several medications. However, if we can introduce a total vegan or vegetarian diet which do not have any cholesterol or very little and very low in fat, which is practiced in our Ornish program, in addition to exercise, stress management, all taken together, we have the potential to decrease the cholesterol buildup and reverse heart disease. So this is what we practice through our Ornish Lifestyle Program, which is consisting of exercise, vegetarian diet, stress management, and a relaxation technique. When put together, they are very healthy in order to reverse heart disease.
So what other changes can I expect if I do this full 9-week program?
The Ornish program is designed and given about 9 weeks in order to make progressive changes in your lifestyle which are cumulative in order to decrease your cholesterol, relieve the symptoms of chest pain and shortness of breath, and exercise is facilitating further your improvement of heart, lung and muscular function. So you are getting a comprehensive improvement with the lifestyle. In addition, when it teaches you about stress management and relaxation, the body's chemical abnormalities are also improved. You are less stressed, so the stress hormones will be decreased, and they are also helping in the recovery process.
What outcomes can I expect after the 9 weeks? So I stay on it for 9 weeks, and then a year later, am I losing weight? How will I know that my heart is healing?
Yes. If we are going to practice the same lifestyle when you graduate in the program in about 9 weeks, you will continue to occur improvement in your health condition. How we can monitor that? You will see that your weight is coming down, your cholesterol level is going to decrease, your blood sugar also going to decrease, and people with diabetes in fact is able to reverse their diabetes and they have gone off the medications. Blood pressure will be better controlled without medication or sometimes with minimal medication. You will find your body is improving in its strength, the ability to do certain physical activities which were impaired before. You will see a gradual improvement. In addition, you will see your mental status also becoming more clear. Your memory is going to improve, all on account of the change in lifestyle as I already elaborated.